So, good afternoon to everybody. So, we are waiting for Chief Guest to arrive, and hopefully he'll be here very shortly. We are trying to keep you engaged with our academic information while we are waiting for him. So, Dr. Balamurali and Dr. Shyamsundar quite eloquently explained the technology that helps us to help our patients to have very precision surgery and have very little complications. And these are very highly minute surgeries where even 1 millimeter error can cause significant damage to the brain. And there are a lot of medical conditions in neurology that we rely on the surgeons to improve our patients on. Apart from tumors, vascular malformations in the brain and spine, there are a lot of changes that happens in the brain chemically. For example, patients may develop tremors in their hands and legs, and like Parkinson's, essential tremor, sometimes abnormal movements of one side of the body called dystonias and so on, which can often be resistant to treatment with medications alone. In those patients, we try and help with surgery. As you all know, human brain is a very highly evolved, complex organ, yet it is very simple in terms of how it functions. There are a lot of parts in the brain that takes care of very eloquent functions like speech, hand function, motor function, your leg movements, balance, and so on. So this video tells the connections within the brain. There are a lot of connections that take care of networks very close to each other, and also long-range networks from the front of the brain to the back of the brain. What you see through your eyes are actually processed at the back of your brain. And it's not like a mini electric circuit that sends signals from A to B. And these signals work at quantum level. We still don't know how the brain functions, to be honest. And it's very amazing to go inside the brain and study how they can function. So coming to our patients with Parkinson's, most of you may have seen or heard of somebody with Parkinson's disease, and often they have a lack of dopamine in the brain. And medically, we treat them by giving dopamine supplementation orally, and sometimes we can also give it as injections. So in the early stage of the disease, there is a very good therapeutic range, which is the green horizontal row, where the medicines work beautifully. If you have too much of medicine, you go to the red range where they have extra unwanted movements. If your medicine is too low, you go into the bottom blue area where you become frozen, you can't move, you become very rigid and slow. As the disease advances, the therapeutic range gets narrow and narrow. So your usual drug will become very toxic, and they may be having quick on and off periods. In these patients, we can reduce the amount of drug that can be given, so they have less side effects, and also improve the motor function. So that's when the deep brain stimulation came out. It's almost like 20 years now we have been well acquainted with how DBS works. In Chennai, quite a few centers have started doing it, and we are quite proud to start the same program in Kauvery with Dr. Balamurali and Dr. Shyamsundar, and also Dr. Bhuvneshwari, who's my colleague, and Dr. Pritika Chari, who's our mentor and guide in our department. So apart from Parkinson's, we can treat other conditions like chronic pain, essential tremor, dystonia. Often resistant depression can also be treated. Even extreme forms of obsessive compulsive disorders can also be treated with DBS. Okay. There are a lot of targets for different situations in DBS, and typically the electrode will go and be placed in particular parts of the brain. There are different eloquent areas, globus pallidus interna, externa, thalamus, and you have subthalamic nucleus and so on. So that's where the neurosurgeon's expertise comes with the latest technology. As Dr. Shyamsundar was showing us, with a probe he can easily pinpoint where the actual points are. The probe can be easily selected. Where we want to put the probe in can be easily defined by using these gadgets. So we also have this stereotactic frame which is put on the patient, and the patient is taken to CT or MR where all the coordinates of particular areas in the brain are mapped like you have your GPS in real time. So as our air marshal here knows very well. GPS helps our pilots to navigate, and I'm sure Abhinandan would have shot plenty of F-16s if, I don't know, if we rely on our own Gagan GPS or still rely on the Western GPS. So we are quite proud to have you here, sir. And also Dr. Shobha, we are very proud of having you, both of you here. So with these coordinates, we can target the areas where we want to put the probe in. So here you can see it has to navigate quite a lot of structures. You have to not puncture the ventricles, go past these areas. Very close to there, we have the internal capsule, which are the motor fibers actually that make you function as a human. And very next to that, we have thalamus, which if wrongly stimulated can cause chronic pain and so on. And in essential tremor, we can target the globus pallidus. So this is dystonia, we can target the globus pallidus interna, and in tremor, we can target the intermediate nucleus of thalamus. And this video sort of gives you an idea how it works. This gentleman has got severe Parkinson's, and as you can see, his stimulator is switched off, and he's having very intractable shaking. As the stimulator is switched on, you would see all his tremor disappears quite nicely.
If I can get my fat fingers to hit the button, there we go. See how it feels. How you feel? Yeah.
So these are patients who would be quite into their medications, and after quite a while, the medicines either don't work or they have very quick on-off episodes.
Feels pretty good? Okay, good.
And this is another video where the same thing can help patients with severe dystonia. This gentleman has got a congenital form of dystonia due to genetic disease, and any typical movement of face or hand can cause intractable dystonic posturing. And often these conditions are predominantly seen in children, and children often benefit with deep brain stimulation for dystonia. And this is post-surgery. You can see how well he is transformed. And Kauvery is well known for quality and safety and also ethical practice. We do work as a team, and we are very strict in patient selection criteria. There are a lot of guidelines behind DBS case selection. We have to go through the rigmarole of all the guidelines, and we do work as a team. And with precision and appropriate patient selection, we can do the right sort of treatment for the right patient at the right time, at the right stage of the disease. So you have to be very sure Parkinson's is at the right stage where you have to intervene and medical therapy has failed and so on. So thanks for listening, and again thank Kauvery for giving such a wonderful opportunity and also a place to work and help a lot of our patients in and around Chennai and also in India.